I'm a respiratory student. I'm here to tell you something new. Have you ever heard of bronchiolitis before?
No, what is bronchiolitis?
Bronchiolitis is a common, one of the common infections for a toddler who are under a baby who are under 2 years and under. Bronchiolitis is a virus infection that affected the airway, so it will make the smaller airway swelling and then filled with a lot of mucus in there, so it will be hard for the baby to breathe.
Is it contagious?
It is contagious, so you just make sure you stay away from crowded place. Stay away from if your child is sick, just stay away from healthy people as well to protect you and the other people around you. So it's similar to it's like similar to a cold, but you will notice your baby would have a runny nose, coughing, sneezing, and like you would hear a noise in breathing, just like a wheezy sounds. The signs and symptoms. The common signs and symptoms are like I mentioned, the runny nose, cough, mild fever, very often happen. The severe signs and symptoms that will need the medical attentions are the one that you will notice. They have hard time breathing. Their lips, they will turn gray, blue, pale in their lips, fingers, or toes. You will notice that. And then most importantly, they have they call rib retractions, which is like when the baby's taken breathing in, you will notice their rib cage like inward, like pulling it in, or like they have a apnea when they stop breathing for a second. So which are the things that you will need to contact your physicians or go to ER right away if you see those conditions.
What if my baby have fever?
If your baby have fever, for the treatment, you can give them Tylenol or ibuprofen, and then for their dehydrations, you can give them electrolyte, and then some physicians will order a nebulizer treatment to help with the airway, to open up the airway. But I also recommend using humidifier at home, like the moist cool mist humidifier. Also, like if you see their nose congested, you can use a nasal spraying and then suction ball to suction off his nose. Or if you have other suction kit, you can suction through their nose to help with ease. And make sure they have plenty of rest and a smaller meal. A small meal, because they're not, once baby are sick, you already know that they're not going to eat. And then give them a lot of fluid like a formula, like I mentioned earlier, Pediatrician, or anything that the baby, like juice that you can mix with, like half water, half juice, to help them stay hydrated. Or like if you notice that the baby have, also the most important things to prevent is that you stay away from other crowded place, sick people, or people who smoke. Make sure you wash your hands and baby hands very often. Clean the toys. Like baby love to touch toys, but make sure you clean the toys and surface area that help also prevent the infections. And then to avoid just like prevention, to avoid just like you avoid crowded place, like I mentioned earlier, avoid sick people, avoid secondhand smoke. So like when the baby inhale the smoke, it can cause them having harder times to breathe, to worsening their respiratory. I also have a handout for you that you can go over the signs and symptoms, and then there is everything that you need. And we also have a website that will help you, we help guide you, or like you can learn more about the bronchiolitis there. You can visit Cleveland Clinic. I also have the link underneath there for you. Is there anything that that I missed?
What are the treatment again?
The treatment, we have a nebulizer. It's some physicians will order a nebulizer treatment, but it depends on your physicians. Some will just recommend a humidifier at home to help with that, and then like a nasal spraying, and then nasal spray and suction the baby nose if they need it, and then Pedialyte with the dehydrations or formula milk that they want, just still help them hydrate it, and then give them plenty of rest.
Okay. Thank you.
You're
That's all.
welcome.